which side has been giving you more grief?
The right side.
The right side. Okay. So what I'm going to do is I'm going to come around towards that right side. And the first thing I'm curious about is now, does it bother you when you're in this position?
No, but when I'm standing on it,
Mm-hmm.
I can feel like if I touch it, it's like right here is tender.
Okay, like right now when you're touching.
Yeah, right there.
Okay. So there's a lot of times when people have discomfort along their IT band where it's not very tender when they touch it, but it's only tender when somebody else touches it. And a lot of times I'll have people, they're flat on the table with their leg down, and then I'll palpate and so forth. But in her case, for her back, she needs her knees to be propped up somewhat. So what I'm going to do is I'm going to gently palpate along this area here, and I'm going to check along in the other areas of your quads and so forth as well. I want you to let me know, tender, tight, sore, anything like that. Okay, and all I'm going to do is I'm just going to prop this foot up a little bit. Is that all right for you so far?
Yes.
Okay, so this is still good for her back, but notice that her knee is a little straighter, a little closer to what things would be like if her leg was actually laying flat on the table. So I'm going to start the palpation at or just below the knee. As I come up along here.
Right there.
Grumpy there. Okay,
Mhm.
as I come up higher.
It's grumpy.
A little grumpy all the way along there.
No, actually,
bad up
it's
there.
more.
More that lower half.
Yeah, right there. That's horrible.
Okay. Yeah, that's horrible. Okay. So I'm just going to kind of keep a fingertip on the horrible spot. I'm going to kind of check right along the front of your quads. Or I should call them quints since there's 5 of them now.
There are.
Yeah. There's a 5th one.
What's the 5th one?
I'd have to look it up here. It's tiny. I kind of ignore it.
It's kind of like Partis.
All right. Now,
They
when I
used to
press
think it was
along the
part of
medial
something.
thigh.
A little tender right there.
Okay, yep. So she's got, yep, she started making grumpy faces. So there's going to be some stuff along the medial thigh that we're going to want to get to. But I want to address this lateral thigh thing here too, because this is one of the big ones, okay? Again, there's a lot of people making a lot of money selling chunks of foam to beat the crap out of this. So let's just eliminate that need, okay? So a couple of options. One option is that I can support her leg a little bit. And Stephanie, I'm gonna need to go where you are.
Okay.
So I need you to move.
In a manner of
Like
that.
act like
Yeah.
So what I'm going to do now is that I'm going to shift your leg off to the side here. Is that okay on your hip at the moment?
Yes.
Okay. So what happens to the lateral thigh when I bring your leg out? When I abduct it a little bit? Do I add tension or slack?
Slack.
Go back.
Yeah, absolutely slack. Okay. So when I press in here now, how does that feel?
Less tender.
Yep. Now, if I bring it a little further out, how does that feel to you now?
Fine.
Okay. So when I press
Does
at
that
it,
hurt
it's
your
okay.
knee?
What?
Does that hurt your knee?
Where?
Is that hurting your knee?
No.
Oh.
Okay. So when I've got your leg out here,
Mhm.
and I just let it flop there, and I press it in here, is that tender at all?
No.
Okay. So, is this something you think you might be able to do on your own?
Yes.
Just lay on your back with your leg up and out?
Mhm.
Cool. One at a time.
Yeah.
Okay. If the other side's been bugging you, do the same thing on the other side. A couple minutes. Okay. Do I need to do anything else? Probably not. Give her a couple minutes to do this, and then get up and move it around. Okay. So this is a really simple way that we can eliminate a lot of the discomfort that people experience along here. And the beautiful thing is that, when people foam roll, a lot of them, it'll temporarily inhibit the ability of the body to use those muscles to full effect. Whereas with this, it's not going to inhibit anything. Okay. So, yep, and she tolerates this very nicely. And then we can bring this back to where we started from. And when I press in here now, how does that feel?
Less.
And when I press down the line here, that's not a really big deal, is it?
Yeah. No. Right
Yeah.
in here's right.
Yeah. So if I
Yeah.
dig hard, I can find something. So this gives me another option. So maybe things come down, decrease to a certain point. Maybe we need to go do a little bit further. So now maybe I'm going to do something more like what I have up on the slide on the screen. And this is also in the DNM manuals, but I'm going to bring her leg. I'm going to adduct it slightly, and a little bit of medial rotation. Okay. Notice I didn't bring her leg way across. It's what, midline, thereabouts. Okay. I'm staying within her comfortable range of motion. Somebody that's really flexible, her leg might go farther across. When I press in here now, how's this?
It's not tender.
Okay. Beautiful. All right. Now the thing is that, you know, I don't need to have my hand here anymore if I already know that it's not tender. So this hand right here, I can support right there. Okay. The other thing I can do, if you have somebody, you know, if you're small and you're working with a partner or a client who's a larger frame, you know, you can certainly come across and support it like this instead. Okay, and also if you're worried about the integrity of their knee too, I can have one hand supporting their knee so that feels safe and secure. Okay, the beautiful thing is that then when we need to, we can come up. Still doing okay here?
Mm-hmm.
Excellent. All right, and then we'll bring this back down to a neutral position again to where it was earlier. I'm going to press the line here now.